Namaste everyone. Welcome to today's Women Health Education program conducted by Ayurveda Academy. Myself Dr. Deepika, volunteer at Ayurveda Academy and I'm practicing in Mysore. So since this January 2024 we have been discussing two main series of sessions. First one is about women health, especially during her most important and very the most crucial phase of her life, starting from her menarche time, and then how to actually what happens during menarche and how we should be prepared for it, and how she should take care of herself during menarche stage, and how she should take care during her menstruation days that happens every month. And then the next important stage of her life will be after marriage and before conception. Usually, people ignore that phase because conception will happen anyhow. After marriage, conception will happen when they actually try for it. But what preparation we should do, all those things are actually matters for both families and even for the future generation that is going to come as our child. So we discussed that important phase also, and how to prepare ourselves, our family, and as a mother, as a father, how we should prepare to welcome that new child to our life. So we discussed that too. And then the next immediate thing will be how to prepare ourselves to welcome exactly during pregnancy time. And we discussed the most important points during pregnancy, how to take care of a mother and how she should look after her, and what should be her priority during pregnancy. All those things we discussed in last few sessions. And today we are going to discuss the most uh, awaiting session, that is how to welcome the newborn as soon as it is born, and uh, how she should prepare as a mother and as a family, how we should be welcoming that child, and the mother who has mother just got rebirth and the baby is coming through her, and we are awaiting for this moment. And if we are ready in all angles, we can actually welcome them to our life in a most meaningful way. So today, to give insights about how to prepare for this most happiest situation in our life, we have Dr. Meghashri Hegde, who is practicing in Mysore. She will be giving the points about this topic. So I welcome Dr. Meghashri Hegde for this session, and over to you.
Namaste. Am I audible?
Yes.
Thank you. Very good afternoon to one and all. If at all there exists a realm in the healthcare sector wherein people who are neither certified nor trained by any medical school voluntarily and altruistically take up the role of healthcare providers and eventually succeed in it in catering to the need only and only by the skills that they have imbibed by their elders, that is the realm of postpartum care, offering care to the newborn and the new mother. So, bowing down to all those wonderful skills and those magical hands of these people who are none other than the Indian mothers, let's get into the topic proper, that is postpartum care of the newborn and mother during first 10 days up to 45 days. All of us very well know that there exists diverse traditional methods in each nook and corner of India for offering this postpartum care for the newborn and new mother. And this diversity has emancipated or it has emanated from the different weather conditions that exists in different location of India and different food habits of the people who reside in different parts of the India with different weather conditions. Say, for example, the practices for offering postpartum care for the mother and newborn in a dampy weather like Uttara Kannada is entirely different from those practices which are being practiced in Uttara Karnataka, which is completely dry and hot. So, these different weather conditions and different food habits and lifestyle of people have given rise to different practices in offering the postpartum care to the mother and newborn. It is also to be noted that these diverse traditional methods, which have emanated in different locations of our country, are appropriate to that weather condition of that respective location and that particular and for that particular food habit and lifestyle. And we have to think twice before practicing or applying certain regimens that has emanated or taken its birth in a particular weather condition with certain atmosphere in other condition. So not all the regimens and rituals are to be practiced in all parts or all different locations. So each and every traditional method which is followed in our country should be applied only after considering the weather condition and of course the rutu in which the labor has happened and many other factors like the strength of the mother and many other like this. So grossly weather conditions matter a lot. All of us very well also know that there are very huge number of traditional methods for offering the postpartum care even in the current era. And even after seeing the people reaping the benefits of this care in proper way, the question that is being posed by the modern world today is this care really necessary or just giving the lady who has delivered a baby complete rest by making her abstain from all physical activities sufficient, or is replenishing the lost blood sufficient? And the answer for this question is a very strict no. That is not sufficient. Because there are many issues in the body of both mother and baby which needs to be addressed individually, and just giving her complete rest and replenishing her lost blood through medicines will not address each and every minute issue of the body of mother and baby. That is, to be more specific, during the postpartum period, that is immediately after the delivery, the condition of body of both mother and baby will be so. That is, all tissues of body of both mother and baby will be very weak. The body of mother will be very obviously weak because she has just lost a very huge amount of blood, which was the vital content of her body. And of course, by all the other physiological changes that her body has underwent during pregnancy and postpartum period. And the body of baby will very obviously be weak because it has just taken the birth and it is yet to grow. So by all these factors, the body of both mother and baby will very obviously be weak. Vata, which is the governing energy of the body, will be in enraged state, both in case of mother and baby, again because of the changes that they have underwent during pregnancy and labor. Agni, that is biofire, that is the entity which helps in digestion or the digestive capacity of both mother and baby will be very weak. And both mother and the newborn will be under severe physical and mental distress due to the changes which have undergone during the labor, or by the very nature of the labor, which is very strenuous and tiresome. So, all these issues needs to be tackled individually, and just giving her complete rest and replenishing her lost blood through medicines will not be sufficient. So, be it any kind of traditional method which is practiced in India since centuries, or be it the principles of Ayurveda, they very strongly aim at addressing all these issues, and they thereby offer a very holistic, complete, and long lasting care. So, the very intention of care provided during postpartum period will address all these issues. That is, they aim at all these issues. They are the care aids the easy flow of lotia. Lotia is the bloody vaginal discharge which immediately starts after the lady has given birth to the newborn, and it lasts up to 4 to 8 weeks. The care helps in alleviating vata, which was enraged during pregnancy and postpartum period, of course. Because as told before, vata itself is the governing energy, and its normalcy matters a lot for proper functioning of body and for everything. Strengthening Agni and all tissues of body of the mother. This is also the aim of the care which is provided during postpartum period. Because Agni, as told before, itself is the power which causes the digestion of the food which is taken in, and the condition of Agni matters a lot for the proper production and proper functioning of the tissues of one of the main aim of the care provided during postpartum period. And this care also aims at aiding a healthy growth and development of newborn. So, the care offered by our traditional methods and the care that which is advocated by Ayurveda especially aims at all these things. So, what if ignored? What if the lady is not ready to take the stingy, illiberal methods which are advocated by our traditional systems and by Ayurveda? And what if she ignores the care which was to be taken during the postpartum period? Will it just cause weakness? No, definitely no. If ignored, if the postpartum care is not provided properly to both mother and the baby, it will result in disorders of vata, as it will be in enraged condition, and the disorders of vata which will emerge in this condition at that time or in long run will be very difficult to cure. So great care should be taken about the entity called vata during this period. Not only this, but also it will cause developmental delays in children too. So, postpartum care needs to be implemented by making necessary and crucial changes in food, activity, and lifestyle of the mother, and also by following certain special regimens during postpartum period. There's a noteworthy point here in between. All the rules and regulations that will be delineated by me further in this presentation are only the general rules that is advocated or advised, and that these are to be followed by a lady who has underwent a normal labor and who is undergoing a normal postpartum period without any comorbidities or complications. So these are just the general rules. If at all there is certain deviation from the normalcy in case of both mother or baby, a proper, a genuine, a really learned Vaidya needs to be consulted. So these are just the general rules. Coming to the rules that are to be implemented with respect to food or food intake, the food taken by the lady in purpurivum or postpartum period should always be hot. And when I mean hot, it is referring to the food items which are hot by nature and also by temperature. Hot by nature, examples for this food would be jeera or ajwain seeds. All these are hot in nature. And keeping the food hot in temperature too also matters a lot, because hot food alone can alleviate vata, and cold food will increase vata, will cause diminished agni. So keeping the food hot is very much necessary. The food should be unctuous. That is, the food should always contain the content of either ghee, oil, or butter. And this again depends on the condition of the mother and also the prevailing rutu in which the postpartum period is going on. The food should always be taken in proper quantity. This proper quantity again is different from person to person. That specific quantity of food which gets digested easily without causing any distress to the individual who has taken it itself is the proper quantity to that individual. So one should observe keenly about the quantity, and It should be made sure that proper quantity of food should be taken at proper time. Proper time here is referring to the proper hunger time. Proper signs and symptoms of hunger should be observed by the lady. That is, when the lady feels the true hunger, that is, like when the lady has pure belching without any smell or taste in it, and when the lady is really feeling lightness in the body, that is said to be the proper symptoms of hunger. And only when these symptoms are observed in her body, she should take proper food at proper quantity in proper time. And then food with pungent, bitter, astringent tastes must be avoided. An example for pungent food would be chili and its products. Bitter is the very popular bitter gourd. Astringent is that which is of kashaya rasa, like that of areca nut. So, food containing all these tastes in dominance should be avoided very strictly because all these again increase vata and decrease the strength of tissues of body. It should also be noted that excess salty, sour food should also be strictly avoided. Intake of food items with the dominance of these tastes will also negatively impact the production of breast milk too. So the details of breast milk production and all entities related to it will be taken up in the next session of this series. Coming to activity and lifestyle. During the postpartum period, all these things needs to be strictly avoided. All kind of strenuous physical activity, sexual intercourse, anger, grief, and anxiety. All these should be completely restrained from the postpartum lady because all these again cause imbalance in the humors of body, and the lady must ensure that she will have sufficient sleep every day. It is very obvious for the lady to have disturbed sleep because of repeated feeding of the baby during the night time and due to other factors also. But she should make sure that she is getting sufficient rest by taking sufficient sleep, at least by taking a quick nap in the morning if necessary. Coming to the special regimens that is to be followed by the postpartum lady who is having postpartum period are these. Oil massage to whole body must be done, followed by a hot water bath regularly without fail, except certain exclusions like when she has the signs of indigestion and all, it should be avoided. But or else, if she is in normal condition, this should be done daily without fail. Dhopana of the place where both mother and baby reside is very much necessary. This cleanses the atmosphere where both mother and baby reside, and it gives a protection. It gives a sense of protection and warmth to the people who are residing there. Wrapping the mother's abdomen with clean, soft, and thick cotton cloth with moderate pressure is very much necessary to avoid the enragement of vata in its place, that is abdomen and lower abdomen and the pelvic region, of course. This is usually practiced in all traditional methods and this is very much necessary too. So Udaraveshana, that is wrapping the mother's abdomen, is very much necessary along with Dhupana and Abhyanga, that is whole body massage. So these are to be followed without fail. And about the pressure for Udara Veshtana, that is wrapping the mother's abdomen, it should be made sure that a 2-finger gap is present between the cloth and the skin of the mother. Coming to care of baby, the baby should always be kept properly covered with clean cloth, and especially the head region of the baby must always be kept covered. Regular oil massage and warm water bath should always be given to baby also. Frequent change of baby's undergarments must be ensured. Regular cleaning of baby's genitals and anal region is very much necessary, because as they urinate again and again very frequently, care of that organ and maintaining the hygiene of the pelvic region of baby too is very much essential. Feeding at proper time and proper posture to the baby matters a lot. So these are the different postures in which a baby can be fed. The baby can be made to stand on the lap of the mother and then it can be fed. This position is very much suitable in the condition where baby has repeated reflex of the milk which he or she has taken in the baby. The baby can be made to sit on the lap of the mother and it can be then fed. The baby can be supported out of hand and then it can be fed. The baby can be made to be in a naive position without any rules, in a free position, and then it can be fed. Similarly, the position for twins is so. Support of pillow can be taken to feed the baby. The baby can be held in a sling and then it can be fed. Or the baby can either be held like though it is present in a cradle and then it can be fed. And similarly, the baby can be fed in lying position also. So these are the different postures in which a baby can be fed. Whatever the position might be, both of the mother and baby, regardless of the position, regardless of the posture, these things should be taken care of. That is, baby's body must always be in line to the mother's body. It should be close to the mother's body and it should always be supported properly. And the baby should always face the breast. Baby's chin should touch the breast of the mother with its tongue reaching much of the breast easily. The baby's body must be aligned with mother's in a way that baby's lower jaw is far from the nipple of the mother. The baby should be led into breast with its chin first and then it should be allowed to latch on. So regardless of the posture, that like whether it is sitting, standing or lying, these things should be taken care of for proper feeding without causing distress both to mother and baby. While all the rules and regimens which I have delineated till now should be very strictly followed for the first 45 days without fail, it should be very intensely followed during first 10 days, because it is the time period during which both the baby and mother have just come out from a very intense physical and mental distress. So it should be made sure that an intense physical and emotional support too is offered to the lady who is in postpartum period to ensure easy and speedy recovery. And it is more beneficial if this emotional and physical care is offered to the lady by people who are really genuine, near, and dear to the lady. And the care during this first 10 days should ensure that there is proper onset of the flow of lotia and there is proper flow of lotia regularly during these days, because scanty flow and excess flow, both of these types of flow of lotia are to be addressed immediately. And hence, the lady should very meticulously observe that there is proper flow of lotia, and food, lifestyle, and special regimens are to be altered if there is alteration in the flow of lotia. That is, if there is either a very scanty flow or excess flow, certain changes needs to be made during this period only. So intense observation regarding the flow of lotia is very much necessary during first 10 days, and in offering intense emotional support too is necessary. And along with this, ensuring proper digestion, that is, the onset of proper hunger after delivery, observing all those things matter a lot during this period, because the Agni, once it is ignited properly during this period, will take up its normal function gradually and will go on normally for a long run. So, igniting the biofire properly during this period is very much necessary. So, observing the signs of digestion and hunger by the lady matters a lot during this period. Keeping a life within the womb, giving birth to it, going through the stressful recovery period of postpartum is not at all easy. Though it is scary and stressful, it is equally sacred too. So let's help all those mothers and all those ladies who are in and around us, who are going through this phase very genuinely, by spreading the word, by taking the necessary actions, and by genuinely catering to their needs and requirement. In total, let's help them heal. Thank you.
Thank you, Dr. Meghrishri. It was really a very useful, elaborate, and very much needed session, because these days when we get patients or the mothers who come, they'll be either in two stages. One, they can't afford time to take care of themselves and to give the proper care for the newborns until those 45 days. Either they'll be busy with their profession or something else, or the another thing is they don't know how to care. These two things are really damaging the future generations and also the family itself. It has got multiple damages we can see with respect to health, physical health, mental health, everything, and even growth of the baby, mental growth, physical growth, emotional growth, all those dimensions of life getting affected because the newborns couldn't get that attention or the care, that pampering, that much necessary for them at that proper stage. because both parents will be busy with their profession, job, work, and running here and there, all those things. So they couldn't give them the care they needed. So, if we understand the necessity and the inevitability of this very crucial period, both for mother to heal herself and for the baby to grow as a healthy individual, we can actually do better. So, thank you for giving wonderful points so that all of us can implement those in our lives. It's not that I'm not a mother or I have already passed that phase, so I need not know all these things. It is not like that now, because if we know these things, how to care properly, at least we can help others. Because nowadays, those who know how to care, how to give the proper care, why this should be done, why this should not be done, this knowledge, if we don't have, we cannot even help others. Because so many people will ask, who will tell us all these things, like that. Earlier days, everyone, every woman in the household will be knowing all these things, whether she knew that why this should be done, why this particular regimen is to be done, why dhupana, all those whys she might not be knowing, but she was knowing how to do it at least. So that became a ritual or a very religious practice in every household. But nowadays, that ritual is also not seen in most of the families. In the name of modernization, we are leaving those rituals or religious customs that were there for our own good. But that's a sad thing. So, what we can do is, at least we should know all these things so that we can guide or we can help those mothers who are in need. So, if you have any questions related to this topic, the session is now open for question and answers, so that we can take few questions here.
Madam, namaste. I am Dr. Anand here.
ನಮಸ್ತೆ, ಹೇಳಿ ಸರ್.
ಮೇಡಮ್, ಫಸ್ಟ್ 1 to 10 days ಅವರು ಅದು ಪ್ರೊಸೀಜರ್ ಏನು ಹೇಳಿದ್ರು ಅದನ್ನ ಸ್ವಲ್ಪ ಎಲಾಬ್ರೇಟ್ ಮಾಡಿ ಹೇಳ್ತಾರಾ? ಕ್ಲಾಸಿಕಲ್ ಆಗಿ ನಾವೇನ್ ಮಾಡಬಹುದು ಅಂತ ಬಾಣಂತಿಯಲ್ಲಿ.
ಓಕೆ, ಶ್ಯೂರ್.
ಯೂಶಲಿ ನಾವು ಎಣ್ಣೆ ಸ್ನಾನ ಮಾಡಿಸ್ತೀವಿ. ಆ ಟೈಮಲ್ಲಿ ಸ್ವರ್ಣಪ್ರಾಶನ ಮಾಡೋದು ಹೇಗೆ, ಅದನ್ನ ಸ್ವಲ್ಪ ಹೇಳಿದ್ರೆ ಚೆನ್ನಾಗಿತ್ತು ಅವರು. ಅದೊಂದು ಆ ಪಾರ್ಟ್ ಹೇಳಿಲ್ಲ ಅವರು. ಹಂಗಾಗಿ ಇನ್ನೇನು ಇನ್ಫಾರ್ಮೇಶನ್ ಆ ಟೈಮಲ್ಲಿ ಮಾಡಕ್ ಸಾಧ್ಯ ನಮ್ಮ ಆಯುರ್ವೇದ ಕಡೆಯಿಂದ ಅಂತ ಅದನ್ನ ಮಾತಾಡಿದ್ರು.
ಓಕೆ, ಒಂದೇ ನಿಮಿಷ ಸರ್. Dr. Megashri, you there? Will you take this question or shall I? Okay. So first 10 days with respect to mother.
Oh. That's okay.
Yeah. We can continue. I thought you were not there.
Yes, sir. As you told, Swarna Bhasma in very small quantity along with Madhu and other Medhya Dravyas is told in Samhitas, but other practices like putting a gold needle-like thing inside vacha and just rubbing it on a stone and making the baby lick that vacha rasa, which was rubbed with Swarna, is practiced everywhere. So this can be done for first 10 days. And all other regimens like Abhyanga is very much necessary only.
Okay, madam. Thank you. That is Swarnavacha Yoga. But we give after 3rd day. Actually, some Samhita reference is there. Only honey is given in the first 3 days. Honey is licked on the tongue of the baby. maybe. Is that
Yeah,
okay?
yeah, that is told. That is told in classics, and many people practice that also, Lakshmana Grita and all, instead of breast milk. But this can be done. Yeah, that is Suvarna Vacha Yoga only, as you rightly pointed it. Yeah, that is what I mentioned about that.
Thank you.
Doctor, hi, am I audible?
Yeah, you can ask.
Yes, doctor. Yeah, actually, my one of my great grandmother, she mentioned that they start breastfeeding only on the third day after the baby is born. But nowadays, doctors suggest that immediately after the baby is born, they have to be breastfed. So, how contradictory are we here? I heard one of my doctor, like the previous doctor whom used to consult, she said you have to give vacha first, like baje first, or you have to give butter first to the kid so that everything inside comes out. Kafa inda ಹೊರಗಡೆ ಬರೋದು ಇಲ್ಲ ಮೋಷನ್ ಇಂದ ಹೊರಗಡೆ ಬರೋದು ಆಗ್ಬೇಕು ಆಮೇಲೆ ಬ್ರೆಸ್ಟ್ ಫೀಡ್ ಮಾಡಬೇಕು ಅಂತ. But nowadays doctors just rush you in the hospital to just breastfeed the baby. So should we just follow this or?
Actually, here the concept, how we perceive Ayurveda Vaidyas or Ayurveda science perceive and that science perceive is little different, and yet, yes, it is a little contradictory. Uh, why they say they have their own reasons, because they consider it as like they say the first feed should be breast milk only, because it contains lot of those nutrients that baby needs, all those things they see it as like this. But what we see and what the perception of Ayurveda science says that first milk or the soon after the delivery, whatever the secretion comes out, that is actually not exactly the breast milk. Okay, so it is not breast milk, it is just a discharge. Because why I'm telling that is, um, see, once a lady is conceived, her menstrual fluid stopped coming out, right? So it got accumulated, and first few months that menstrual fluid, whatever got converted from what is she eating every day, every meal, one part of essence getting converted as menstrual fluid, now it is not coming out as menstrual fluid, but it is getting collected for its actual purpose, to serve its actual purpose. Because now it baby is there, so baby is the ultimate purpose of this entire reproductive system. So the this menstrual fluid which was coming out, now it is getting collected, and it is serving its purpose by protecting baby in different forms, like becoming placenta, becoming amniotic sac, becoming amniotic fluid. All those structures are formed through this substance itself. And then once all these structures are formed, again she'll be eating continuously, right? Did not stop eating. So what happens, that essence part of her food getting accumulated in her breast also, which is next important thing for mother, preparing her breast for the breastfeed. So as soon as delivery happens, this collected menstrual fluid or the transformed menstrual fluid, which is stale because it was stored till 9 months, right? So we can consider, or we can call it as stale food. So do you want to feed your baby stale food, the first food of that baby's life? Do you want to feed it with stale food? No, right? Because it is stale, we can see what impact or what damages it can cause to the baby in different angle. But what that science says is they only see what nutrient aspect it has, and that is necessary for baby. Of course breast milk is very much necessary, but after 3 days. What you told, what you mentioned was very much right. In fact nature itself has made it like that. first 3 days or first 2 days, or for some mothers for first few days, like it will take up to 1 week also, they don't get breast milk as much as like in a flow. It will come only little by little, drop by drop, that much only. So it will not be sufficient for the baby also. Why? Because she started bleeding per vagina, so all the collected menstrual fluid or the essence of those food is going through the inward outlet, and now the breast is getting prepared to prepare the fresh food, breast milk needed for the baby. So the question comes then, what about baby? What should we feed? So again, what you mentioned was right. In our text, what Ayurveda suggests is first feed should be either ghrita, that is pure ghee mixed with honey, or butter, fresh butter, preferably the fresh one, churned and collected butter, along with honey. And when we tell this, I know what and all questions will pop out in our head, because one thing will think, will the baby eat this? Will the baby have this food as a food? Yes, definitely. Baby will like this food because honey will be there and it is very soft in consistency. It can easily have. In fact, it will like it more. So, baby will definitely like this food. Second question, mostly it will be coming like, is it sufficient? Yes, it is sufficient, because when you see the nutrient aspect of both butter and honey, it is sufficient for that baby who is just come out and its digestive system is yet to get active. It can't process the food that is artificial or stale. In example of breast milk, the first day's breast milk, it is stale. It can't process it completely. Of course, it has got multiple nutrients, but if the baby can't process it, uh, dividing the waste product and all, then that waste product itself will be the cause for diseases in the baby. So this butter and fresh butter, preferably homemade butter. If not, even the store bought one will work. With honey, will do the thing. Then, how much should we give and when to give? This question will come. So, Ayurveda says the amount of butter should be measured with the palm size of the baby. The palm of baby should be like at least this much. So if you can roughly measure your baby's palm and measure roughly the ball of butter size, and then mix it along with honey, little of honey. Or if you are sure that honey is very pure and all, you can mix equal ratio of honey with butter. Then mix it well and make the baby lick this mixture. And will it be sufficient? How frequently should we give? As we feed with breast milk, the same principle applies here also. Baby will eat or lick that mixture until it is full. Once it is full, the baby will not lick. Stop licking and it will start puking out. So then you stop that. That is another indication about the quantity of how much. And another thing is how frequently. So once the baby digests that amount of butter and honey, it is completely digested, and then usually baby passes urine or stools, and then baby will be hungry, then it will start crying, and once it starts crying, you can give the second feed or the next feed of the same thing, whatever, butter and honey or ghee or and honey. This same thing should be continued every time it cries after digestion, after passing urine. You can give this as a feed for the baby. So this should be ideally continued until the breast milk of mother is pure, and they have given how to check breast milk, whether it is pure or not, whether it is not stale now, it is fresh breast milk that is needed for the baby. That also is there, which we'll see in the next upcoming sessions of WHP, how to check breast milk for its purity and all. So once it is pure, we can feed the breast milk immediately. So this thing depends on individuals. Like for some women, it will happen within 2 days. The breast milk will come pure and it will start flowing, not drop by drop. It will start flowing so that baby can have full tummy feed. Then for some women, it will take 3 days, 5 days, depending on her health condition and what kind of birth it happened, vaginal birth, sometimes cesarean. For women who had underwent cesarean, for them, this kind of breast milk will take little longer time to come because of something happening inside. So it will take time. So what we should do, can we tell doctors and feed only butter or ghee like this? If we say, sometimes some doctors at some hospitals, they will agree, they will tell that yeah, you can give whatever at your own risk, they will tell. But at some hospitals, some doctors cannot understand what we are saying, so they won't support you, or they don't agree with what we are saying. So they might tell you not to feed these things. So it depends on your own condition, like how much you have followed all the routine, all the things that were supposed to be followed during pregnancy, before pregnancy, and after pregnancy, what you are going to follow, how much you are ready to take these things, how far you are ready to take these things. It all depends on so many factors: family support, doctor support, institution support. All those things needs to be considered before doing this. Otherwise, if you are not in a position to go against your family, or even in the hospitals, we cannot practically, sometimes we cannot go against them. Then uh, what best we can do is, at least uh, these things, these points will be covered in the next session also, but I'm just briefing it down. Um what best we can do is apply ghee to breast completely, allow it to absorb completely, and then try to feed. So what we are trying to do is, ghee is best for best as a healing agent. So whatever discharge or breast milk coming out, that breast milk will get processed by this ghee, and the ghee, essence of ghee, will reach the baby through this feed. So at least this much we can do at hospitals, or whenever the things we cannot do much, we can do at least this much. So I hope
Thank you, Doctor. Yes, Doctor. Thank you so much. I actually wanted to mention something here. One of my friend's wife, like she herself is an Ayurvedic doctor. So apparently she gave birth recently. Her baby is like 5, 6 months old now. She completely followed Ayurvedic principles. Like she took only Ayurvedic medicines, and she never popped a pill, not even a single English pill. And still, she gave birth to a very beautiful, happy, healthy baby. So I was very happy to have known that she followed everything properly, and she gave birth to a beautiful, healthy baby. So I just want to mention that here. And she followed all the principles properly.
yeah,
So I'm happy that this in this age, I mean this year, like she still followed everything properly and she gave birth to a beautiful baby. So just wanted to mention it here. Thank you, doctor. Thank you
yeah,
so
great.
much.
Thank you for mentioning it here. So shall we move on to the next session? Okay. The next session, of course, you all know, we are talking about very basic things that are found in our kitchen, which we use it as our daily food, and at times we use them as are medicine also. So having knowledge about those ingredients that can become both food and medicine is very important as a homemaker or women or even a family member. So with this intention, we are trying to cover ingredients one by one, group by group, as mentioned in our text. So until now, we have covered about water, about other liquids, about milk, and about um, oils also, cooking oil in the last episode. And today we are going to see about grains, especially the cereals. So today we have Vaidya volunteer Inchara to share knowledge about these grains or cereals. So I welcome Vaidya volunteer Inchara for this session.
Namaste, welcome you all for this session, Know Your Food. So let's begin today's session.
Doctor, you have to unmute yourself.
Sorry. Welcome you all for this session, Know Your Food. So let's begin with this session by understanding what is this Shukadhanya Varga today. So basically these Shukadhanya Vargas are nothing but cereals. We all know about cereals, right? We use it in our home like rice, wheat, ragi, etc. So let's see one by one and what are its properties and how can we use it in a better way. First, what is the Shukadhanya? These Shukadhanyas are monocotyledon plants and very famously known as cereals, and they are characterized with the needle-like sharp edges. You might have seen the rice grain or wheat and everything. And also these are very economically important as food sources for both human and also for animals. So what are these then? Mainly in these cereals, we basically use rice, wheat, ragi, barley, jowar and millets. Millets, we all are very familiar with millets, right? In today's life, it is navne, sami, udalu, etc. So let's see one by one. First one is rice. In Sanskrita, we name it as Shali Dhanya, and the properties of this rice is it is sweet in taste and it is slightly astringent also, and it is Shita andre ದೇಹಕ್ಕೆ ತಂಪನ್ನ ನೀಡುವಂತಹದ್ದಿದು. Next, it is unctuous ಅಂತಂದ್ರೆ ಬಾಡಿನ ಡ್ರೈ ಮಾಡ್ಸಲ್ಲ ಇದು. It is unctuous for the body. And mainly it functions of this is it mainly provides strength for the body and it alleviates the pitta and slightly increases the kapha in the body, and it is very easy for digestion also. So we already know a lot of varieties of rice, right? For example, basmati, red rice, sonam masuri, bangarat kadi or jirge sana, etc. Among all these, red rice is one which is having the property to elevate all three doshas, that is vata, pitta, kapha, all three doshas, and also good for the heart. Among all these rice grains, Shashtika Shali is considered to be the best. Shashtika Shali means the rice which is grown in the span of 60 days. Mainly, this rice is considered to be the most stable food in our daily life, which can be given in most of the ill health conditions also, except in few like prameha or obesity, some like that. Except that it is considered to be the most staple food for everyone. So, because it can be digested very easily and it will not be heavy for digestion also. So, for example, like in the conditions like Agni Mandya or where the digestion fire is less, or in Ajirana conditions, in Jwara, in all these conditions, this rice or in the form of ganji will be easily digestible. Next, also in the conditions like vomiting, diarrhea, etc., where the energy of that person would have gone down, like ಶಕ್ತಿನೇ ಇರಲ್ಲ ಏನು ಕೆಲಸ ಮಾಡೋಕ್ಕೂ ಸುಸ್ತಾಗ್ತಾ ಇದೆ ಅನ್ನೋ ಕಂಡೀಷನ್ನಲ್ಲಿ this rice can be used in the form of ganji, which provides pushti for that person. Next one is ragi. In Sanskrita, we call it as madhulika. The properties of this properties are it is sweet in taste, it is slightly astringent also, and it is also light to digest just like rice, and it is rough in nature. ಅಂದ್ರೆ ಬಾಡಿಗೆ ಇದು ಸ್ವಲ್ಪ ಒಣಗಿಸತ್ತೆ ಬಾಡಿನ ಅಂತ. Coming to the functions of this ragi, it reduces both kapha and pitta in our body. It provides strength for the body and it gives stability for muscles. As it is quite ಶೀತ in nature, ನಮ್ಮ ಬಾಡಿಗೆ ದೃಢತೆಯನ್ನು ಕೊಡಲಿಕ್ಕೆ ಇದು ಹೆಲ್ಪ್ ಆಗುತ್ತೆ. Even this ragi is considered to be the staple food in South India mainly, and also people like laymen, laborers consume this because it gives stability for their muscles to do strenuous exercise or strenuous works which they follow or they do. And also this ragi can be consumed mainly in different forms like ragi dosa, ragi mudde, and also in the form of ragi ambli also. Comparatively, this ragi dosa is light for digestion compared to ragi mudde. The person who is having less digestive fire ಅಥವಾ ಅಜೀರ್ಣದ ಕಂಡೀಷನಲ್ಲಿ ರಾಗಿ ದೋಸೆ would be better compared to ರಾಗಿ ಮುದ್ದೆ. And ರಾಗಿ ಅಂಬ್ಲಿ ಸಹ ನಾವು ಕೇಳಿರ್ತೀವಿ ಅಲ್ಲ, ವಿಚ್ ಇಸ್ ವೆರಿ ಲೈಕ್ ಶೀತ ಅಂತಂದರೆ ಬಾಡಿಗೆ ತಂಪನ್ನ ನೀಡುವಂತಹದ್ದು ದಿಸ್ ambli. This ambli is prepared out of majjige. The thing which we have to be cautious about here is that majjige or that buttermilk should not be sour. If that buttermilk is sour in that ambli, it will have the adverse effect instead of positive effects. So we have to be cautious about that buttermilk while preparing this ambli out of it. Next one is the wheat, or we call it as godhuma. The properties of this is it is comparatively heavy to digest compared to rice and ragi. It is quite heavy to digest, but still it is unctuous in nature and sweet to taste. Mainly it elevates vata and pitta in our body and it helps for binding. ಅಂತಂದರೆ ಸಂಧಾನೀಯ ಗುಣ ಇದೆ ಅಂತ ಹೇಳ್ತೀವಿ, ಅಂದರೆ ಜೋಡಿಸೋ ಕ್ರಿಯೆಯನ್ನು ಇದು ಚೆನ್ನಾಗಿ ಮಾಡುತ್ತೆ. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಇನ್ ಕೇಸಸ್ ಲೈಕ್ ಫ್ರ್ಯಾಕ್ಚರ್ಸ್, ವೂನ್ಸ್ ಆ್ಯಂಡ್ ಆಲ್, ಇಂಟರ್ನಲಿ ಗೋಧಿಯನ್ನು ಅಥವಾ ಚಪಾತಿ ಅಥವಾ ಗೋಧಿಯಿಂದ ಪ್ರಿಪೇರ್ ಮಾಡಿರುವ ಯಾವುದೇ ಒಂದು ಫುಡ್ ಪ್ರಿಪ್ರೇಷನ್ಸ್ನ ಕೊಡೋಕ್ಕೆ ಹೇಳ್ತೀವಿ, ಬಿಕಾಸ್ ಇಟ್ ಹೆಲ್ಪ್ಸ್ ಫಾರ್ ದಟ್ ಬೈಂಡಿಂಗ್. And also it is very much strength for the body. And in generally in olden days it was used and very much indicated in burn wounds. They prepare shira andre ಸಜ್ಜಿಗೆ ಮಾಡಿ ತಿನ್ನುವಂತಹ ಪದ್ಧತಿ ಸಹ ಇದೆ. Next one is barley, that is yava. The properties of this is it is also ಶೀತ ಅಂದರೆ ದೇಹಕ್ಕೆ ತಂಪನ್ನು ನೀಡುವಂತಹದ್ದು and slightly heavy for digestion compared to other cereals, and it is also sweet in taste but rough in nature, ಅಂದರೆ ದೇಹನ ಒಣಗಿಸುವಂತಹ ಕ್ರಿಯೆಯನ್ನು ಮಾಡುವಂತಹದ್ದು. Main functions of this is it dries up the body. Especially we indicate this barley in conditions like madhumeha, sthaulya. Sthaulya means obesity, or in some skin diseases also where the oozing is present. In those conditions, we instruct people to use this barley as food, and also it increases the bulk of the stool in people. In South India, generally it is not considered to be the most staple food, where in North India people are used to have this barley, as there will be no compulsion to use, as it is not so much staple for everyone. But in condition like Madhumeha, as told earlier, it is very much indicated. In conditions like where barley is necessary for that person, or if that person is not used to consume that barley in his life, instead of using only barley, he can also add wheat along with it, and he can mix both wheat and barley and prepare chapati or some other food preparations out of it, and he can use it. This barley ganji is considered to be ಅಂದರೆ ದೇಹಕ್ಕೆ ತಂಪನ್ನು ನೀಡುವಂತಹದ್ದು. ಸೊ ಇನ್ ಕೇಸಸ್ ಆಫ್ ಉಷ್ಣ ಅಂದರೆ ಬಾಡಿ ಹೀಟ್ ಆಗಿರೋ ಕಂಡೀಷನ್ ಅಲ್ಲಿ barley ganji is very much indicated. And also in the place where there is muscle laxity in the person, in all these conditions, barley is very much indicated for that person. Next one is jovar, that is jurna. It is sweet to taste. It is slightly astringent also. It is also shita in nature, and it is light to digest, and it is also rough in nature. So north side alella hodre we come across this khadak roti alva. Khadak roti na they will eat that roti with a huge amount of curd or with the butter, just because in that situation or in that region it will be very sunny. Still, to undergo some, or if they are layman, or to do some strenuous exercise or do some strenuous works, they need the strength to work. For that condition, they use this jovar as a food to balance that. For the kala or that rutu in that particular place, they add a huge amount of curd, or they have it with the butter there. So it mainly increases the vata and also reduces the kapha in the body, and it does the shoshana, means it dries up the things. The last one and the most favorite one for all of us, which is very much trending nowadays in the market, those are millets, right? We call it as kudhanya. These are like navane, same, udalu, arka, badagu, etc. These are quite ushna to our body, and also quite astringent in taste, and also slightly sweetish to taste, but mainly it is quite astringent to taste. It is also rough in nature and quite tangy in nature for the body after digestion. It mainly reduces the kapha in our body, and also reduces the production of urine content in our body, and also increases the vata and pitta in the body. So these millets are very much indicated in people who are hefty, and where the condition is like when a person have more of kapha in his body, and the person who is newly diagnosed with the diabetes or some skin diseases, it is quite indicated to use the millets. But if the person is very lean, or he is already a vata person, in those conditions we don't recommend more of this millet. If that person has to consume this millet, we advise him to consume this millet in the form of whatever food preparation he wants to do, but along with a huge amount of ghee adding to it. Otherwise, it may cause him the stomach pain or some other critical conditions also. And it causes malabadhate, means it is constipative also. So we suggest generally while using millets, add more amount of ghee, or have other stuffs like ghee, butter, curd along with it. So all these dhanyas are mostly used in India and are highly palatable to most of the people like us. Though there are many in number according to the variety, the one which is grown in these in their own living area is more suitable for them. For example, ragi roti is more inculcative or more suitable for us in South Karnataka, where jolad roti is more used by North Karnataka people. Like that, we have to use which is suitable for our own living area and for our own body. The selection of item for the preparation of a particular person should be correct. For hefty people, generally barley and wheat is good for the same condition. If the person is lean, we advise him to take rice preparations more compared to this barley and wheat preparation. So, with the knowledge of this, we can make use of cereals for a particular person at a particular condition, at a particular time, and also at a particular season. Thank you.
Thank you, Vaidya volunteering, Chara. So we can take questions if you have any regarding these two sessions now.
Hi, doctor. I have one doubt. Is it good to consume ragi by frying it and grinding it and making it a powder, or is it good to ಮೊಳೆ ಬರತ್ತಲ್ಲ ರೂಟ್ಸ್ ಎಲ್ಲ ಬರುತ್ತೆ ಆಮೇಲೆ ಅದನ್ನ ಗ್ರೈಂಡ್ ಮಾಡಿ ಪೌಡರ್ ಸ್ಪ್ರೌಟ್ ಮಾಡಿ ಆಮೇಲೆ ಪೌಡರ್ ಮಾಡಿ ತಿನ್ನೋದಾ? ಲೈಕ್ ವಾಟ್ ಇಸ್ ಮೋರ್ ಹೆಲ್ದಿ, ವಾಟ್ ಇಸ್ ಮೋರ್ ಈಸಿ ಟು ಡೈಜೆಸ್ಟ್?
ಓಕೆ, ಸಿ ಫಸ್ಟ್ ಥಿಂಗ್ ಈಸ್ ನೀವು ಹೇಳಿದ ಎರಡು ಆಪ್ಷನ್ ಏನಿದೆಯಲ್ವಾ, ಎರಡು ಆಪ್ಷನಿಂದ ನಾವು ವಿ ಆರ್ ಟ್ರೈಂಗ್ ಟು ಗಿವ್ ಸಂಸ್ಕಾರ ಟು ದಟ್ ಪರ್ಟಿಕ್ಯುಲರ್ ಇಂಗ್ರೀಡಿಯೆಂಟ್, ಆ್ಯಂಡ್ ದಟ್ ಸಂಸ್ಕಾರ ವಿಲ್ ಕ್ಯಾನ್ change or can enhance the quality of original quality of that particular ingredient. ಸೊ ಈ ಹುರಿಯೋ ಸಂಸ್ಕಾರ ಇದೆಯಲ್ಲ, ಇದು ವಾಟ್ ಇಟ್ ಮೇಕ್ಸ್ ಇಸ್ it makes that particular ingredient gets lighter to digestion. ಸೊ ಯೂಶಲಿ ನಾವೇನು ಹೇಳ್ತೀವಿ, ಹುರಿಯೋದ್ರಿಂದ ಡೈಜೆಷನ್ನಿಗೆ ಇನ್ನೂ ಈಸಿಯಾಗಿ ಆಗುತ್ತೆ. ಅಕ್ಕಿ ಈವನ್ ಇಟ್ ಈಸ್ ಲಘು, ದಟ್ ಈಸ್ ಡೈಜೆಷನ್ನಿಗೆ ಲೈಟರ್ ಇದ್ರೂ ಹುರಿಯುವ ಸಂಸ್ಕಾರದಿಂದ ಇನ್ನಷ್ಟು ಅದು ಲೈಟರ್ ಆಗುತ್ತೆ ಅಂತ. ಸೊ ಸೇಮ್ ಥಿಂಗ್ ಅಪ್ಲೈಸ್ ಹಿಯರ್ ಆಲ್ಸೋ. ರಾಗಿ ಆಸ್ ಸಚ್ ತಿನ್ನೋದಕ್ಕಿಂತ when compared to ragi as such, frying it with or without this ghee or this oil thing makes it even more lighter. Okay, this is first thing. Second one, the sprouting the ragi thing. So sprouting is actually another samskara, soaking it in water for a long time and then allowing it to sprout. So what happens here is that the seed starts sprouting, and it wants to become a new life. So what happens here is we call it as virudha dhanya, that is sprouting seeds. So this has got its own effects when compared to plain ragi or other grains. So it becomes heavier for digestion. That is, if ragi is lighter for digestion, after sprouting it becomes comparatively heavier for digestion. Second thing, all the sprouted dhanyas are not suitable for everyday consumption. Like just we said, all these dhanyas we consume it every day and it is our staple food. But once it is sprouted, we cannot call it as a staple food which we can have it every day. Once in a while it is fine to have, but not for everyday consumption because of two reasons. One is, of course, it becomes heavier for digestion. Another thing is it has got one more very damaging effect on our eyes. We call it as drishtighna. That means it directly affects the vision or eye thing. It affects the vision. So, Virudha dhanya or sprouted seeds, any sprouts is not advisable for regular consumption for anyone. Okay, so this is the rule with sprouted seeds. So now you must tell which one is healthy, which one is not healthy according to your own body condition and where you stay. And how is your Agni, all those things you can check, and you can decide how much frequently you can have, in what form you can have. And when you take ragi, if you have that problem like low appetite, some people will have, after having ragi mudde, either they will get stomach upset or this uh, heavy for digestion, no, so it will take longer time for them to get appetite back. So for them, ragi should be consumed in lighter versions, like after frying it, instead of having mudde, they can have it in the form of ganji. So these alterations should be made according to their own individual needs, looking their own needs.
ಓಕೆ ಡಾಕ್ಟರ್, ಗಾಡ್, ಥ್ಯಾಂಕ್ ಯು. ಬಟ್ ಆಕ್ಚುಲಿ ಡಾಕ್ಟರ್, ನಾನು ಆ ರಾಗಿನ ತೊಳೆದು ಒಣಗಿಸೋ ಅಷ್ಟ್ರೊಳ್ ಒಳಗಡೆನೆ ಅದು ಸ್ವಲ್ಪ ಸ್ವಲ್ಪ ಚಿಕ್ಕ ಚಿಕ್ಕದಾಗಿ ಲೈಕ್ ಸ್ಪ್ರೌಟ್ಸ್ ಬಂದ್ಬಿಡತ್ತಲ್ಲ. ಸೊ ಏನ್ ಮಾಡೋದು ಇಮಿಡಿಯೇಟ್ಲಿ? ಅಂದ್ರೆ ಬಿಸಿಲಲ್ಲಿ ಒಣಗಿಸ್ದೆ ಮನೆ ಒಳಗಡೆ ಒಣಗಿಸ್ತೀವಲ್ಲ, ಸೊ ಇಟ್ ಟೇಕ್ಸ್ ಮಚ್ ಲಾಂಗರ್ ಟೈಮ್ ಟು ಡ್ರೈ. ಸೊ ಅದು ಆಟೋಮೆಟಿಕ್ ಆಗಿ ಸ್ಪ್ರೌಟ್ಸ್ ಚಿಕ್ಕ ಚಿಕ್ಕದಾಗಿ ಬಂದ್ಬಿಡತ್ತೆ. ಅದು ಆಫ್ಟರ್ ದಟ್ ಐ ಕ್ಯಾನ್ ಫ್ರೈ ಇಟ್ ಅಂಡ್ ದೆನ್ ಕಂಟಿನ್ಯೂ ಯೂಸಿಂಗ್, ಆ ಥರ ಮಾಡ್ಬೋದಾ? ಇಲ್ಲ ಫ್ರೈಯಿಂಗ್ ಆಮೇಲೆ ಬೇಡ?
ಇಟ್ಸ್ ನಾಟ್ ಲೈಕ್ ಯು ಶುಡ್ ನೆವರ್ ಈಟ್ ಇಟ್ ಅಂತ ಆ ಥರ ಏನಲ್ಲ, ತಿನ್ಬಹುದು. ಓನ್ಲಿ ಥಿಂಗ್ ಇಸ್ ಕನ್ಸಿಡರ್ ಯುವರ್ ಅಗ್ನಿ ಶಕ್ತಿ and then not that you are intentionally sprouting it and then you're doing it. So as soon as you wash them, you need not soak it for very long time, and then spread it on the cloth actually, so that it absorbs all the moisture. And after once it gets little less in the moisture content, you can just fry it.
Okay, okay, okay. Got it, doctor. Okay, thank you, doctor. Thank you.
Namaskara, doctor.
Namaste. Yeah.
Doctor, I wanted to ask, if somebody is pre-diabetic and has a little weight and they are trying to lose it, which is the best cereal a person can eat? Because if you, I mean, from the presentation, I understood that millet has various properties, and if it is matlab, if somebody has it regularly, then certain side effects can also be there.
Yes. So in the condition which you mentioned, pre-diabetic and have more weight issues.
Yeah.
So considering only these two things, if I had to answer, then I would suggest them to use or include barley and also millets also, but considering their again digestion, how much they can digest, and what type of koshta, that is the gut nature they have. Can they pass bowel movements easily without any strain, or if they have this constipation issues, then they have to consider adding more good fat along with these food, either barley or millets, because it is going to absorb more of fat or moisture content, and it will make them pass little hard motion. So if they already have that problem, then they should make sure that good amount of fat should be added along with this food. So barley is very much recommended in such conditions. It helps in both the condition. One, excess fat or excess weight that we are trying to lose, and second thing is pre-diabetic condition. In both the condition, barley is the best grain which we can use. But if you are not accustomed with barley, if you are using it for the first time, don't use it completely. Don't swap the rice completely with barley. Just try to add barley little by little in your everyday meal in different forms. Maybe one day you can have ganji, one day you can have that whole seeds, that barley thing, boiled and prepared into either this porridge, or you can also prepare different variety of recipes like khichdi also, or upma, something like that, and then use it with little by little, adopt, and then you can shift it to this one. And the second very important point is how long they should take and what they
Yeah.
should observe, should be observing, and when they have to stop, or stop taking these things in their diet is one thing. If they get more of vata predominance in their body, lakshanas like symptoms, like if they are getting more of pains, or if they are having trouble to digest the food, if they are having trouble to pass the motion, either hard or constipation, one day they cannot pass it completely or clearly. These are all the things they should consider. If this is happening, then they should consider reducing the amount of these ingredients in their diet, or they have to stop. And these are the things, when we are including in our food, we should also consider that it should be gradual. Like all of a sudden you shouldn't shift to the new food habits if it is not there in your diet already.
Okay, ma'am. Ma'am, one more follow-up question. If the body is Pitta Pradhan,
Mhm.
then it is fine to have barley and millets,
Yes,
right?
barley is very
Okay.
much indicated in Pitta Pradhana body because it is
Okay.
very cooling. So even Pitta Prakriti person can have. Vata Prakriti person, if he is already having Vata related issues or Vata Prakriti, then they should uh, consume it cautiously. Otherwise, Pitta and Kapha, both predominant person, can have it barley easily.
Okay, ma'am. Thank you so much.
And even barley is very heavy for digestion, so it will take long time for digestion. So whoever has good digestion capacity, one who feels hunger very frequently between the meals and all, they can include barley so that they feel full for the longer time, and they can avoid in between, munching in between the meals. Okay, Manju.
Doctor,
Yes.
yeah, doctor, I wanted to find out, is it okay to mix the grains? Like we get this multi-grain atta or multi-millet, some shavige and all that. Is it okay to use those?
For this question, I should answer in a very diplomatic way, because one thing we should be knowing why we are mixing, what we are expecting from this mixture. So, whether we want to get all the nutrients at once, or we are considering other factors also. Because, see, sometimes if we are mixing two things which have two extreme qualities, and which is very predominant extreme qualities, then mixing both of them will not do any good for us. So, for example, take it barley, and barley is very cooling, no, and it is very drying in nature. It absorbs the fat and moisture in our body. So, along with this, with that, if you mix a thing which is having more of opposite quality, extremely opposite quality, and we cannot expect both of them do its own work. So there it comes the controversy, which will do their work, whether barley will do its cooling effect or the other thing will do its heating effect, that we cannot predict actually. So this was one example that came just now. So like this, we have to consider why we are mixing, if we are mixing, why we are mixing, and it could be for the taste purpose also. Sometimes two things when mixed gives very good texture to the recipe or very nice taste, enhanced flavor to the recipe. Then also consider whether these two things are supporting each other, not contradicting each other. That should be taken care of. Otherwise, you can mix. It's not that you should never mix any grains or cereals like that. Only thing is consider these things. Don't just do it blindly.
Got it.
And sometimes one more thing, what happens, what we see is people gets multigrain atta done by themselves by mixing things like oats and even soya bean seeds, all those things, thinking that it will give their, it will enhance the nutrient value of the same chapati or same wheat flour they are using. But again, in this condition, in this example, oats and this soya bean is having, are both are them are having very unique qualities. Like one, both of them are vata aggravating properties, very much dry in quality, and these things are not grown here around us, so it is exported and it is not made for us. Nature has not made for us. So mixing those things in our wheat may enhance the nutritive value when we check in the lab, but inside our body, whether it will give the same nutritious effect or not, it depends on the person or individual. So while doing such mixture, so consider these things also.
ಓಕೆ ಥ್ಯಾಂಕ್ ಯು.
Okay.
ನಮಸ್ತೆ ಮೇಡಮ್.
Namaste.
ಮೇಡಮ್, ಈಗ ವಾತದ ಪ್ರಕೋಪ ಜಾಸ್ತಿ ಇರೋರು, ಅಂದ್ರೆ ಅವ್ರ ದೇಹದಲ್ಲಿ ವಾತದ ಕಂಡೀಷನ್ಸ್ ಜಾಸ್ತಿ ಇದ್ರೆ ಯಾವ ಗ್ರೈನ್ಸ್ ನ ಯೂಸ್ ಮಾಡ್ಬೇಕಾಗತ್ತೆ? ರೈಸ್ ಇಸ್ ಬೆಟರ್ ಆರ್ ಈಗ
ವಾತದ ತೊಂದರೆ
ಬೇರೆ?
ಇದ್ದವರಿಗೆ ರೈಸ್ ಬೆಟರ್. ರೈಸ್ ಸ್ನಿಗ್ಧ ಗುಣ ಅಂತ ಹೇಳ್ತೀವಿ, ಅಂದ್ರೆ ಇಟ್ ಡಸಂಟ್ ಡ್ರೈಸ್ ಔಟ್. ಯಾವಾಗ ತುಂಬಾ ಒಣಗಿಸೋ ತರಹ ಮಾಡುತ್ತೆ ಅವಾಗ ವಾತ ಇನ್ನೂ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಸೊ ರೈಸ್ ಇಸ್ ನಾಟ್ like that. So rice can be eaten. Even wheat is also considered as snigdha and guru, so that will also help to control the vata. And in grains, among grains, millets is not that suitable for vata prakriti person. So if vata is there or vata is troubling in form of disease, or I myself is vata prakriti person, then while taking these grains like millets or even barley or any other things, even ragi can be good for vata prakriti person. But other than these, they should be cautious, not take too much of millets, don't take too much of barley, or without having ghee or good fat, do not take these millets and barley thing.
ಮ್ಯಾಮ್, ಈಗ ಉದ್ದುನು ಸ್ವಲ್ಪ ಎನ್ಹಾನ್ಸ್ ಮಾಡುತ್ತೆ ವಾತ ಪ್ರಕೋಪನು ಅಂತ ಹೇಳ್ತಾರೆ.
ಉದ್ದು
ಅದು ಸ್ವಲ್ಪ ಆಗುತ್ತೆ ಹಾಗೆ. ದೋಸೆ ಅಥವಾ ಇಡ್ಲಿ ತಿಂದ್ರೆ ಸ್ವಲ್ಪ ಬ್ಲೋಟ್ ಆದಾಗ ಆಗುತ್ತೆ ಸ್ವಲ್ಪ ತಿಂದ್ರೆ. ಅದ್ರ ಬದಲಾಗಿ ಮೆಂತ್ಯ ಉಪಯೋಗಿಸ್ಕೊಂಡು ತಿಂದ್ರೆ ಮೆಂತ್ಯ ವಾತನ ಕಮ್ಮಿ ಮಾಡುತ್ತಾ ಅಥವಾ ಹೇಗೆ? ಮೆಂತ್ಯ ದೋಸೆ ಆತರ ಎಲ್ಲ ಮಾಡ್ಕೊಂಡು ತಿಂದ್ರೆ?
ಇಲ್ಲಿ ನಾವು ಇನ್ನೊಂದು ವಿಷಯವನ್ನ ಇನ್ನೊಂದ್ಸಲ ಕ್ಲಿಯರ್ ಆಗಿ ನೋಡೋಣ. ಒಂದು ವಸ್ತುವಿಗೆ ಇರುವ ತನ್ನ ಸ್ವಾಭಾವಿಕ ಗುಣ, ಅಂದ್ರೆ ಅದು ಒರಿಜಿನಲಿ ವಿತೌಟ್ ಎನಿ ಅದರ್ ಅಸೋಸಿಯೇಷನ್ ಅದು ಹೇಗಿರುತ್ತೆ, ಏನ್ ಎಫೆಕ್ಟ್ ಅನ್ನ ಮಾಡುತ್ತೆ ಅಂತ. sometimes we don't eat it alone, we prepare some recipe along with so many other ingredients, so then it need not do the same original function in our body. So ಈ ಉದ್ದಿಂದು ಎಕ್ಸಾಂಪಲ್ ತಗೊಂಡಾಗ, ಉದ್ದು ಆಕ್ಚುಲಿ ಒರಿಜಿನಲಿ ಅದನ್ನು ನೋಡುವಾಗ ಇಟ್ ಈಸ್ ವೆರಿ ಹೆವಿ ಫಾರ್ ಡೈಜೆಷನ್ and it is snigdha, that is it doesn't dries the body content inside, So it is snigdha, it gives unctuousness in our body. So considering these two things, it pacifies vata, or if not pacifying, it controls vata. It doesn't harm to the vata. But when we prepare idli or dosa or something like that, we add so many other things to it, and the process, the fermentation process, soaking process, all these makes it more guru, that is more heavier for digestion. So because of these processes, we experience these kind of bloating or even gastric trouble after eating dosa or idli. So these things are, we think that these things causes more vata, but in fact after digestion, after completely digested, this same uddu will help pacify or to control the vata. But since it is more heavier for digestion and it is very snigdha and it increases kapha pitta, so after effect it can take different dimensions depending on the person's nature. If the person is already having kapha or pitta uh, dominance in his body, then uh, along with vata, pitta and kapha will also get affected. So if the person is already having gastric issues, like he cannot digest the food and he has got this sour belching after eating food, or late digestion or problem with bowel movements, then for that person this particular recipe prepared out of this uddu will become more problematic in that condition. ಸೊ
Thank you,
ಆಕ್ಚುಲಿ
ma'am.
ಮೆನಾರ್ಕೆ ಟೈಮ್ನಲ್ಲಿ ಈವನ್ ಬಾಣಂತಿಯರಿಗೆ ಉದ್ದನ್ನ ಕೊಡ್ತೀವಿ. ಸೊ ಅಲ್ಲಿ ಕೊಡುವಾಗ ಇಂಟೆನ್ಷನ್ ಈಸ್ ಆಕ್ಚುಲಿ ಹೆಲ್ಪಿಂಗ್ ಧಾತುಗಳು ಸ್ಟೇಜಲ್ಲಿ ಆ ಪರ್ಟಿಕ್ಯುಲರ್ ಲೇಡಿಗೆ ಧಾತುಗಳು ಚೆನ್ನಾಗಿ ಬಲ ಸಿಗಬೇಕು. ಅದಕ್ಕೆ ಶಿ ಶುಡ್ ಗೆಟ್ ಮೋರ್ ಸ್ಟ್ರೆಂತ್ and vata should be under control, and this particular reproductive organs should get more strength. So with that intention we give them uddu also. One of the food is uddu. So there what we do usually is we add more of this tuppa or ghee, right? And also we do not prefer giving fermented form of this uddu in the very first few days. After that we can give, but the very first few days of after menarche or after delivery, we don't suggest them to take fermented dosa or idli in those form, but we advise to take them uddu. ಹಾಗೆ ಬೇಯಿಸಿ ಅದಕ್ಕೆ ತುಪ್ಪ ಹಾಕಿ ಕೊಡ್ತಾರೆ. ಚೆನ್ನಾಗಿ ತುಪ್ಪ ಬೆಲ್ಲ ಎಲ್ಲ ಹಾಕಿದಾಗ ಡೈಜೆಷನ್ ಆಗುವಾಗ ಆಗುವ ವಾತದ ತೊಂದರೆ ಆಗೋದಿಲ್ಲ. ಆಫ್ಟರ್ ಡೈಜೆಷನ್ ಇಟ್ ವಿಲ್ ಹೆಲ್ಪ್ ಟು ಕಂಟ್ರೋಲ್ ವಾತ.
ಹಾಗಂದ್ರೆ ವಾತದ ಪ್ರಕೋಪ ಇರೋರು ಉದ್ದಿನ ಕಾಳು ತಿನ್ಬಹುದು ಬೇಯಿಸ್ಕೊಂಡು ಇದ್ ಮಾಡಿ ಅಂತ, ಅದು ಇಟ್ ವಿಲ್ ಹೆಲ್ಪ್ ಅಸ್ ಅಂತ ಹೇಳ್ತೀರಾ?
ವಾತ ತೊಂದ್ರೆ ಮಾತ್ರ ಇದ್ದು ಜೀರ್ಣ ತೊಂದ್ರೆ ಇರ್ಲಿಲ್ಲ ಅಂದ್ರೆ ತಗೊಳ್ಬಹುದು ಒನ್ಸ್ ಇನ್ ಅ ವೈಲ್ ಅಲಾಂಗ್ ವಿತ್ ಗುಡ್ ಅಮೌಂಟ್ ಆಫ್ ಘೀ ಆರ್ ಬಟರ್ ಲೈಕ್ ದಟ್. ಅಕಸ್ಮಾತ್ ಅವರಿಗೆ ಜೀರ್ಣ ತೊಂದರೆ ಇದೆ ಅಂಡ್ ಅಸೋಸಿಯೇಟೆಡ್ ಸಮ್ಟೈಮ್ಸ್ ವಾತದ ಜೊತೆಗೆ ಬೇಗನೆ ಕಫನೂ ಅವ್ರಿಗೆ ತೊಂದರೆ ಆಗುತ್ತೆ, ಶೀತ ಬೇಗ ಆಗುತ್ತೆ ಅಂತೆಲ್ಲ ಇದ್ರೆ ಉದ್ದು ಸ್ವಲ್ಪ ಅವಾಯ್ಡ್ ಮಾಡಬೇಕಾಗತ್ತೆ. ಇನ್ ದ ಫಾರ್ಮ್ ಆಫ್ ಎನಿ ಫಾರ್ಮ್ ಅವಾಯ್ಡ್ ಮಾಡಬೇಕಾಗತ್ತೆ ಅಥವಾ ಕಾಶಿಯಸ್ ಆಗಿ ತಗೊಳ್ಬೇಕಾಗತ್ತೆ. ಓನ್ಲಿ ವಾತದ ತೊಂದರೆ, ನೋಡಕ್ಕೂ ಸಣ್ಣ ಇದ್ದಾರೆ, ದೇ ಡೋಂಟ್ ಗೇನ್ ಮಚ್ ಆಫ್ ವೇಟ್ ಆಫ್ಟರ್ ಹ್ಯಾವಿಂಗ್ ಗುಡ್ ಮೀಲ್ಸ್ ಅಂತೆಲ್ಲ ಇದ್ರೆ ಡೆಫಿನೆಟ್ಲಿ ದೇ ಕ್ಯಾನ್ ಹ್ಯಾವ್ ಉದ್ದು.
ಥ್ಯಾಂಕ್ ಯು.
Any other questions we have?
ಡಾಕ್ಟರ್, ಒಂದು ಕ್ವೆಶ್ಚನ್ ಇತ್ತು. ಈಗ ಋತುಗಳ ಜೊತೆಗೆ ಈ ಸೀರಿಯಲ್ಸ್ ಆರ್ ದೇ ಲಿಂಕ್ಡ್ ಸಮ್ವೇರ್? ಈಗ ನಮ್ಗೆ ಚಪಾತಿ ಬೇಸಿಗೆಲ್ ಜಾಸ್ತಿ ತಿನ್ಬೇಡಿ, ತುಂಬಾ ಹೀಟ್ ಆಗುತ್ತೆ, ಅಥವಾ ರಾಗಿ ಅಂಬ್ಲಿ ಆತರ ಹೇಳ್ತಾರೆ. ಮತ್ತೆ ವಿಂಟರ್ ಅಲ್ಲಿ ಈಗ ರಾಗಿ ತಿಂದ್ರೆ ತುಂಬಾ ಇದಾಗ್ಬೋದಾ ಅಂತ, ಶೀತ ಆತರ, ಅಥವಾ ಹೇಗೆ ಎಷ್ಟು ಮಟ್ಟಿಗೆ ಋತುಗಳಿಗೆ ಅನುಸಾರವಾಗಿ ಸೀರಿಯಲ್ಸ್ ತಗೊಳ್ಳೋದು? ಮತ್ತೆ ಈಗ ಫಾರ್ಮ್ಸ್ ಅಂದ್ರೆ ಈಗ ಅಕ್ಕಿ ಹಿಟ್ಟು ಎರಡಕ್ಕೂ ಏನಾದ್ರು ಡಿಫ್ರೆನ್ಸ್ ಇದೆಯಾ? ಈಗ ಶುಗರ್ ಇದ್ದವ್ರು ಅಕ್ಕಿ ತಿನ್ಬಾರ್ದು ಅಂತಾರೆ. ಬಟ್ ಅಕ್ಕಿ ಹಿಟ್ಟು ಮತ್ತೆ ಆತರ. ಸೊ ನಾನು ಅಕ್ಕಿ ತಿನ್ನಲ್ಲ ಅಂತ ಹೇಳಿ ಮತ್ತೆ ಅಕ್ಕಿ ಹಿಟ್ಟಿಂದೇ ರೊಟ್ಟಿ ಮಾಡ್ಕೊಂಡು ತಿಂದಾಗ ಅದ್ರ ಎಫೆಕ್ಟ್ ಎಷ್ಟಿರತ್ತೆ ಶುಗರ್ ಲೆವೆಲ್ಸ್ ಮೇಲೆ?
ಓಕೆ. ಫಸ್ಟ್ ಕ್ವೆಶನ್ನು ಋತುಗನುಸಾರ ಇದು ನೋಡಿದರೆ ಸೀರಿಯಲ್ಸ್ ವಿಷಯ ನೋಡಿದ್ರೆ ಅಫ್ಕೋರ್ಸ್ ಇಟ್ ಮ್ಯಾಟರ್ಸ್. ಯಾಕಂದರೆ ನಾವು ಬೇಸಿಗೆಯಲ್ಲಿ ಬಾರ್ಲಿ ಅಥವಾ ಈ ಥರ ಈಗ ಶರದ್ ಋತು ಏನು ಶುರುವಾಗ್ತಿದೆ, ಅಫ್ಕೋರ್ಸ್ ಈಗ ಬಿಕಾಸ್ ಆಫ್ ಸೈಕ್ಲೋನ್ ಮಳೆಗಾಲದ ತರಹನೇ ಇದೆ, ಬಟ್ ಆ್ಯಕ್ಚುಲಿ ದಿಸ್ ಈಸ್ ಶರದ್ ಋತು, ರೈಟ್? ಸೊ ಇನ್ ಶರದ್ ಋತು ಆಲ್ಸೋ ದ ಹೀಟ್ will be more in the environment, so does it in our body. So ಅವಾಗಲೂ ಕೂಡ ಬಾರ್ಲಿ ಅಥವಾ ಅಕ್ಕಿ, ರಾಗಿ ಇವುಗಳನ್ನು ಬಳಸಲಿಕ್ಕೆ ಹೇಳ್ತೀವಿ. ಸೊ ದಟ್ ಇಟ್ ಹೆಲ್ಪ್ಸ್ us regulate the temperature difference or this potency difference, hot or cold potency difference between our body and outside the nature. So ಇದು ಖಂಡಿತವಾಗಿ ಮ್ಯಾಟರ್ ಆಗುತ್ತೆ. ಯಾರಿಗೆ ಅದು ಕೆಲವ್ರು ಹೇಳ್ತಾರೆ ತೀರ್ಥ ತಗೊಂಡ್ರೆ ಶೀತ ಆಗುತ್ತೆ, ಮಂಗಳಾರತಿ ತಗೊಂಡ್ರೆ ಉಷ್ಣ ಆಗುತ್ತೆ. ಇದು ಒಂದು ಬಾಡಿ ಕಂಡೀಷನ್ wherein they are very much sensitive to external changes also, to any little changes also. ಅವರಲ್ಲಿ ಇದು ತುಂಬ ಎವಿಡೆಂಟ್ ಆಗಿ ಕಾಣಿಸುತ್ತೆ. ಲೈಕ್ ಒನ್ ಡೇ ಇಫ್ ದೇ ಹ್ಯಾವ್ ಹೀಟಿಂಗ್, ಈ ಹುರುಳಿ ಕಾಳು ಇದನ್ನು ಮಳೆಗಾಲ ಟೈಮ್ನ ಆಸುಪಾಸಿನಲ್ಲಿ ತಿನ್ನುವ ಅಭ್ಯಾಸ ಕೆಲವು ಕಡೆ ಇದೆ. ಸೊ ಅದನ್ನೇ ಯಾರಾದರೂ ಮಳೆ ಚೆನ್ನಾಗಿ ಬೀಳುವ ಟೈಮ್ ಅಲ್ಲದೆ ಮಳೆ ನಿಂತು ಜೋರು ಬಿಸಿಲಿರುವ ಟೈಮ್ನಲ್ಲಿ ತಿಂದಿದ್ರೆ ಅವರಿಗೆ ಅದೇ ಹುರುಳಿಯಿಂದ ತೊಂದರೆ ಆಗ್ತಿರುತ್ತೆ. ಹೀಟಾಗಿ ಅವರಿಗೆ ಗ್ಯಾಸ್ಟ್ರಿಕ್ ಆಗೋದು ಅಥವಾ ಉರಿ ಇತ್ಯಾದಿ ಸಮಸ್ಯೆಗಳು ಇದ್ದಿದ್ದು ಹೆಚ್ಚಾಗಿ ಕಾಣಿಸೋದಾಗ್ತಿರುತ್ತೆ. ಸೊ ಯಾರಿಗೆ ಆ ತರಹ ಬಾಡಿ ಇರಲ್ಲ, ಅಂದರೆ ಅಲ್ಪ ಸ್ವಲ್ಪ ಲಿಟಲ್ ಚೇಂಜಸ್ ಅವ್ರಿಗೆ ಮ್ಯಾಟರೇ ಆಗಲ್ಲ, ಬಾಡಿಯಲ್ಲಿ ಕಾಣಿಸ್ಕೊಳ್ಳಲ್ಲ, ಅವ್ರಿಗೆ ಗೊತ್ತಾಗ್ತಿರಲ್ಲ, ಬಟ್ ಒಳಗಡೆ ಅದ್ರ ಇಂಪ್ಯಾಕ್ಟ್ ಆಗ್ತಾ ಇರುತ್ತೆ. ಸೊ ಅಕಾರ್ಡಿಂಗ್ ಟು ದ ಸೀಸನ್ ನಮ್ಮ ಸುತ್ತಮುತ್ತ ಯಾವ ತರಹ ಕ್ಲೈಮೆಟಿಕ್ ಕಂಡೀಷನ್ ಚೇಂಜ್ ಆಗ್ತಿದೆ ಅದನ್ನು ನೋಡಿ ನಮ್ಮ ಬಾಡಿ ಕಂಡೀಷನ್ ಅದಕ್ಕೆ ಹೇಗೆ ರೆಸ್ಪಾಂಡ್ ಮಾಡ್ತಿದೆ ನೋಡಿ ವಿ ಕ್ಯಾನ್ ಆಲ್ಟರ್ ದ ಥಿಂಗ್ಸ್. ಇವತ್ತು ತುಂಬ ಮಳೆ ಇದೆ, ಮೋಡ ಇದೆ, ಚಳಿ ವಾತಾವರಣ ಇದೆ ಅಂದರೆ ಅವಾಗ ಮನೆಯಲ್ಲಿ ಯಾವ ಗ್ರೇನ್ಸನ್ನು ಬಳಸಬಹುದು, ಇದರದ್ದು ಒಂದು ಸಣ್ಣ ಲಿಸ್ಟ್ ತಲೆಯಲ್ಲಿ ರೆಡಿ ಇಟ್ಕೊಳ್ಳೋದು. ಯಾವಾಗ ಬಿಸಿಲು ಜಾಸ್ತಿ ಇದೆ, ಹೀಟ್ ಅನಿಸುತ್ತೆ, ಸೊ ಆ ಕಂಡೀಷನಿಗೆ ಅನುಸಾರವಾಗಿ ಏನು ಮಾಡಬಹುದು ಅಂತ ಒಂದಷ್ಟು ಲಿಸ್ಟ್ ನಮ್ಮ ತಲೆಯಲ್ಲಿ ರೆಡಿ ಇದ್ದರೆ ಅಡುಗೆ ಮಾಡುವಾಗ ಚಾಯ್ಸಸ್ಸು, ಮೆನು ಡಿಸೈಡ್ ಮಾಡುವಾಗ ಚಾಯ್ಸಸ್ನ ನಾವು ವೈಸ್ ಆಗಿ ಮಾಡ್ಕೊಳ್ಬಹುದು. ಇನ್ನು ಎರಡನೇ ಕ್ವೆಶನ್ ನೀವು ಕೇಳಿದ್ದು ಅಕ್ಕಿ ಎಕ್ಸಾಂಪಲ್ ಹೇಳಿದ್ರಿ, ಅಂದರೆ ಡಯಾಬಿಟೀಸ್ ಇದ್ದವರು ಅಕ್ಕಿ ತಿನ್ನಬಾರ್ದು ಅಂತ ಹೇಳ್ತೀವಿ ಅಥವಾ ಅನ್ನ ತಿನ್ನಬಾರ್ದು ಅಂತ. ಬಟ್ ಅಕ್ಕಿ ಹಿಟ್ಟು ಸೇಮ್ ಕ್ವಾಲಿಟಿನ? ಅಫ್ಕೋರ್ಸ್ ಹೌದು, ಸೇಮ್ ಕ್ವಾಲಿಟಿನೇ. ಅಕ್ಕಿ ಹಿಟ್ಟು ಡಸಂಟ್ ಮೇಕ್ ಮಚ್ ಡಿಫ್ರೆನ್ಸ್, ಬಿಕಾಸ್ ಯಾವುದೋ ಒಂದು ಪ್ರಾಸೆಸ್ನಿಂದಾಗಿ ಅದು ಚೇಂಜ್ ಆಗಿ ಇನ್ನೊಂದು ಫಾರ್ಮ್ ಪಡ್ಕೊಳ್ತು ಅಂದರೆ ಆ ಪ್ರಾಸೆಸ್ನಿಂದ ಏನಾದರೂ ಚೇಂಜಸ್ ಆಗಿದೆಯಾ ನೋಡಬಹುದು. ಇಲ್ಲಿ ಜಸ್ಟ್ ಅಕ್ಕಿಯನ್ನು ಪುಡಿ ಮಾಡಿದ್ದು. ಇಫ್ ಇಟ್ ಆಲ್ ಯು ಹ್ಯಾವ್ ಫ್ರೈಡ್ ಇಟ್ ಬಿಫೋರ್ ಪೌಡ್ರಿಂಗ್ ಇಟ್, ಅವಾಗ ಅದು ಅಕ್ಕಿ ಇನ್ನೊಂದು ಸ್ವಲ್ಪ ಲೈಟರ್ ಆಗುತ್ತೆ ಹೊರತು ಇದು ಡಯಾಬಿಟೀಸ್ ಇದ್ದವರಿಗೆ ಅಥವಾ ಪ್ರಮೇಹ ಇದ್ದವರಿಗೆ ಯಾರು ತಿನ್ನಬಾರ್ದು ಅಥವಾ ಕಡಿಮೆ ತಿನ್ನಬೇಕು ಅಂತ ಹೇಳಿರ್ತಾರೋ ಅವರಿಗೆ ಇದರಲ್ಲಿ ಯಾವುದೇ ಚೇಂಜಸ್ ಆಗಿರಲ್ಲ, ಅಂದರೆ ಸೇಮ್ ಎಫೆಕ್ಟನ್ನೇ ಮಾಡುತ್ತೆ. ಹಾಗಾಗಿ ನಿಮ್ಮ ಡಾಕ್ಟರ್ಸು ನಿಮಗೆ ಡಯಾಬಿಟಿಕ್ ಕಂಡೀಷನ್ ಇದ್ದು, ನೀವು ಪ್ರಮೇಹ ಕಂಡೀಷನ್ ಇದ್ದು ನಿಮಗೆ ಅಕ್ಕಿಯನ್ನು ಕಡಿಮೆ ತಿನ್ನಬೇಕು ಅಥವಾ ತಿನ್ನಲೇಬಾರ್ದು ಅಂತ ಹೇಳಿದಿದ್ರೆ ಆವಾಗ ಅಕ್ಕಿನೂ ತಿನ್ನಬಾರ್ದು, ಅಕ್ಕಿ ಹಿಟ್ಟನ್ನು ಬಳಸಬಾರ್ದು. ಎರಡೂ ಒಂದೇ ಎಫೆಕ್ಟನ್ನು ಕೊಡುತ್ತೆ.
ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ಡಾಕ್ಟರ್.
ಓಕೆ, ಆರ್ ದೇರ್ ಎನಿ ಅದರ್ ಕ್ವೆಶನ್ಸ್? Okay, so actually
ಡಾಕ್ಟರ್ ಈ ಟಾಪಿಕ್ಸ್‌ನ ಮತ್ತೆ ಎಲಾಬ್ರೇಟ್ ಆಗಿ ಸೆಪರೇಟ್ ಆಗಿ ತಗೊಳ್ತೀರಾ? ಅಂದ್ರೆ ರೈಸ್ ಸೆಪರೇಟು, ರಾಗಿ ಸೆಪರೇಟು ಆ ಥರ? ಅಥವಾ ಇಸ್ ಇಟ್ ಒಂದೇ?
ಅಂದ್ರೆ ಈಗ ನಾವು ಕವರ್ ಮಾಡ್ತಾ ಇರೋದು ಸೀರೀಸ್ ಅಲ್ಲಿ ಗ್ರೂಪ್ ವೈಸ್ ಮಾಡ್ತಾ ಇದೀವಿ. ಗ್ರೂಪ್ ಅಲ್ಲಿ ಬರೋದು ಯಾವ್ದೆಲ್ಲ ಇದೆ ಅಂಡ್ ವಿಚ್ ಎವರ್ ಇಂಗ್ರೀಡಿಯೆಂಟ್ಸ್ ವಿ ಯೂಸ್ ಇಟ್ ರೆಗ್ಯುಲರ್ಲಿ ಇನ್ ಅಂಡ್ ಅರೌಂಡ್ ಅವರ್ ಪ್ಲೇಸ್, ಅದನ್ನ ಕವರ್ ಮಾಡಕ್ ಟ್ರೈ ಮಾಡ್ತಿದ್ದೀವಿ ವಿತ್ ಇನ್ ದ ಟೈಮ್ ಲಿಮಿಟ್. ಸೊ ನೆಕ್ಸ್ಟ್ ಬರುವ ಸೆಷನ್ಸ್ ಅಲ್ಲಿ ಯು ರಿಯಲಿ ನೀಡ್ ಇಟ್ ದೆನ್ ವಿ ಕ್ಯಾನ್ ಡೆಫಿನೆಟ್ಲಿ ಡೂ ಇಟ್. ಅಂದ್ರೆ ಇಫ್ ಯು ಎಕ್ಸ್ಪ್ರೆಸ್ ವಾಟ್ ಯು ನೀಡ್ in the group or even in the sessions, live sessions itself, then we can take up those things.
Okay doctor.
Okay, so in fact ನಮಗೆ ಇದು ಈ ಚಾಪ್ಟರ್ಸ್ ಏನಿದೆಯಲ್ವಾ ಆಯುರ್ವೇದದಲ್ಲಿ ನಾವು ಕೋರ್ಸ್ ಮಾಡುವಾಗ ಓದೋದಕ್ಕೆ, ಈ ಚಾಪ್ಟರ್ಸ್ ಯೂಶಲಿ while we are reading for exams we tend to ignore these chapters because ಎಕ್ಸಾಮ್ಸ್ ಅಲ್ಲಿ ಅಷ್ಟೊಂದು ಇದ್ರ ಬಗ್ಗೆ ಕೇಳಕ್ ಹೋಗಲ್ಲ. ಕೇಳಿದ್ರು ಒಂದೆರಡು ಕ್ವೆಶನ್ಸ್ ಬಂದಿರುತ್ತೆ. ಸೊ ವಿತೌಟ್ ಇವನ್ ಆನ್ಸರಿಂಗ್ ದೀಸ್ ಕ್ವೆಶನ್ಸ್ ವಿ ಕ್ಯಾನ್ ಈಸಿಲಿ ಪಾಸ್ ಅನ್ನೋ ಒಂದು ಟೆಂಡೆನ್ಸಿ ನಾವು ಸ್ಟೂಡೆಂಟ್ಸ್ ಆಗಿರುವಾಗ ಇರುತ್ತೆ. ಬಟ್ ದೆನ್ ದೀಸ್ ಚಾಪ್ಟರ್ಸ್, ಆಫ್ ಕೋರ್ಸ್ ದೀಸ್ ಚಾಪ್ಟರ್ಸ್ ಆರ್ ವೆರಿ ಬಿಗ್ ಇನ್ ಅವರ್ ಟೆಕ್ಸ್ಟ್. ಸೊ ವಿ ಯೂಶಲಿ ಟೆನ್ ಟು ಇಗ್ನೋರ್ ದೀಸ್ ಚಾಪ್ಟರ್ಸ್ ಆ್ಯಂಡ್ ಇಟ್ ಈಸ್ ಟೂ ಮಚ್ ಅಲ್ವಾ, ಒಂದೊಂದೇ ದ್ರವ್ಯದ ಬಗ್ಗೆ ಡೀಟೇಲ್ ಆಗಿ ಓದೋದು. ಸೊ ವಿ ಟೆನ್ ಟು ಇಗ್ನೋರ್ ದಿಸ್ ಚಾಪ್ಟರ್. ಬಟ್ ಒನ್ಸ್ ಆಫ್ಟರ್ ಎಕ್ಸಾಮ್ಸ್ ವೆನ್ ವಿ ಸಿ when we sit as a doctors or even when we are practicing, these are the chapters which we have to understand, we have to by heart, we have to know these chapters because that much value is there in our day-to-day practice. ಬಿಕಾಸ್ ನಾವು ತಿನ್ನೋದು ಏನು ತಿಂತಾ ಇದ್ದೀವಿ, ಅದರದ್ದು ಕ್ವಾಲಿಟಿ ಏನು, ಅದು ನಮ್ಮ ಮೇಲೆ ಹೇಗೆ ಅಫೆಕ್ಟ್ ಮಾಡ್ತಾ ಇದೆ ಅನ್ನೋದು ಗೊತ್ತಿಲ್ಲದೆ ವಿ ಕೆನಾಟ್ ಪ್ರಾಕ್ಟೀಸ್ ಆ್ಯಸ್ ಆಯುರ್ವೇದ ಡಾಕ್ಟರ್ಸ್. ಪೇಷಂಟೇ ಇರ್ಬೋದು ಅಥವಾ ನಮ್ಮ ಪರ್ಸ್ನಲ್ ಲೈಫಲ್ಲೇ ಇರಬಹುದು. ಸೊ ಟು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಅವರ್ ಸೆಲ್ಫ್, ಅವರ್ ಲೈಫ್, ಅವರ್ ಹೆಲ್ತ್, ಆಲ್ ದೋಸ್ these things are very important, these knowledge. And of course information wise we get a lot of information about these things everywhere. Nowadays information is not a thing that is very much hard to get, it is very easy. But having a holistic approach or having knowing things that actually matters, in practically in our day-to-day life is very important. And when we see those information, many of them, I don't say all of them, many of in those information they lack certain perspective. They might be having how much nutrient, which nutrient it has, all those things. But what happens after taking this inside our body, that perspective will be lacking in those information. And if we decide our diet or our menu in our everyday kitchen based on only on those nutrient values, only on nutrient values, of course we should consider them too, but if we depend only on those information and if we ignore these things, what happens in our body and how it is getting digested, how it is going to impact our health, and how it is going to help as a medicine in certain times, all those things, if we don't know those things, then it won't help actually. Until one time we can do those things like measuring the nutrients and all those, planning our diet according to the nutrient value, calorie value, all those things. But after one point it becomes a lacuna because we see a lot of patients coming with a list of complaints, but they are following very good diet instructions, whatever they got in information from different sources. According to them, they are putting a lot of efforts to fine tune their diet thing, but the missing part will be these things. So we are trying to give that dimension, or we are trying to understand those dimension according to the Ayurveda text, so that we can have the holistic perspective about these things which we use regularly as food. So we hope this session is helpful for every one of us, and we hope you all interact like actively like every session, and we appreciate your participation in live program instead of waiting for YouTube link, so that we can have discussion like this. And otherwise what happens is we can just give you information, we cannot discuss, and then with those information, only information, again we will be still having only information, not the knowledge about those ingredients. So we prefer you to attend live session so that we can discuss and learn more. So with this we conclude today's women health education program. Thank you for everyone for participating actively in this session too. So let's meet in the next month, November month, again in this platform. We'll conclude today's program with Swasti Mantra. Thank you for being here.
Ma'am, sorry.
Yeah.
Hello. Yeah, ma'am, I had a request. So if we can have another session on Ayurveda for pets, if you can, for animals.
Okay, that's quite an interesting topic. We'll consider your request whenever we can do that. We'll
Okay, ma'am.
definitely do that.
Thank you so much.
श्रीगुरुभ्यो नमः हरिः ओम् स्वस्ति नो मिमीतामश्विना भगः स्वस्ति देव्यतिथिरनर्पणाः स्वस्ति पूषा असुरो दधातु नः स्वस्ति द्यावा पृथिवी सुचेतुनाः स्वस्तये वायुमुपप्रवामहै सोमं स्वस्ति भुवनस्य यस्पतिः बृहस्पतिं सर्वगणं स्वस्तये स्वस्तय आदित्यासो भवन्तु नः विश्वे देवानो अद्या स्वस्तये वैश्वानरो वसुरग्निः स्वस्तये देवा अवङ्कृभवः स्वस्तये स्वस्ति नो रुद्रः पात्वं हसः स्वस्ति मित्रावरुणा स्वस्ति पथ्ये रेवति स्वस्ति न इन्द्रश्चाग्निश्च स्वस्ति नो अदिते कृधि स्वस्ति पन्थामनुचरेम सूर्या चन्द्रमसा विव पुनर्ददताघ्नता जानता सङ्गमेमहि स्वस्त्ययनं ताक्ष्यमरिष्टनेमिं महद्भूतं वायसं देवतानाम् असुरघ्नमिन्द्रसखं समत्सु बृहद्यशो नाभमिवारुहेम अम्भोमुच माङ्गिरसङ्गयं च स्वस्त्या आत्रेयं मनसा च ताक्ष्यम् प्रयतपाणिशरणं प्रपद्ये स्वस्ति संवादेष्वभयं नमस्तु ॐ शान्ति शान्ति शान्तिः हरिः ॐ